We are here for Logic Models, the roadmap to success. And as I mentioned, I'm going to talk a lot about this the whole entire time, the roadmap to success, and why this is so important, and why the more that you make this a living, breathing document, the more you weave it into the work you're doing every single day, the more impactful your work is going to be in terms of what the strategies you're putting into place with your coalition. And yes, Tammy, I will make sure that you have access to those slides. Absolutely. So our goal is to keep everybody engaged. Obviously, the online training, you've all been doing this on Zoom already, but really the more you guys can talk and chat, do some Q&A to make sure that I can be giving you everything you want and need within this next hour and a half. I want to make sure that happens. So yes, just like Tammy said, will we have access to the slides? Yes, anything like that, please put it in. And right now I'm going to see, I believe I already have these in PDF for you. So let me see if I can put those in, Tammy, right now as we speak for everyone. One second. If I can find it quickly, I will get it into the chat for you, Tammy.
You can't drop things into the chat box here.
Oh, you can't? Okay. Sorry.
We'll make them available on the website after.
Thank you. Thank you, Brittany. All right. So why are we here today? 3 main reasons. We want to learn how to review and revise logic models for maximum impact. Again, how we can make sure to really weave them into the work we're doing on a daily basis. How we can engage in mapping effective strategies and activities to those logic models. And you'll see as I'm doing this, I'll be talking about capacity through this whole entire thing, how you can make sure you're bringing this back. And then learn tips for how to intentionally really map strategies for greater impact, how we can layer them to get the biggest bang for our buck, which we're all looking to do. We're all have, stretch our staff thin, always worried about efficiency and resources. And so really, how can we make sure right now, starting from this foundational piece, that we are making sure that we're going to have that maximum impact and really efficient use of our time and money. So before we get started, I want to hear from you. Why are you here today? What are you looking to get out of the session the next hour and a half so I can make sure that I'm addressing those concerns? And if you can't think of anything that way, what are the biggest barriers you're facing right now as you're thinking about bringing the logic models back to your communities from the National Coalition Academy? So why you're here, what are some of the biggest barriers? Please go ahead and put into chat. Thank you. Brittany's got that live transcription ready for you. Katarina says, list of data sources for logic models or how to find data sources for local conditions. Okay, we'll definitely be talking more about that. Make sure local conditions align with root causes. Oh, Casey speaking my love language. Absolutely, we'll be talking about that. Improve on logic model, Leanne. Trying to put together a logic model for marijuana with not a lot of data. So we're going to be talking about how we can find new sources for data through storytelling. So we'll definitely be hitting that, Paula. Figuring out data, a lot of data questions. Okay, youth engagement has been a bit of a barrier, as well as lack of IDing at local stores. Our biggest barrier is still trying to get information on our local conditions. Looking for skills to lead the coalition. Yes, absolutely. And like I promised, every step of the way, you can have some tips and tricks on each of the slides of how you can bring this back to your coalition to engage them. A lot of data questions. Okay, so as I'm going through, make sure if anything's triggering, you're like, okay, wait, how would I get that? Make sure you're using the chat, because I'll continue to look at that to make sure, especially with those data comments, that I'm making sure I cover those. Develop logic models that really reflect the level of community readiness. We are in vague awareness. Yes, absolutely. And the fact that you know that is very strong. So we will be talking about that as well. Connecting with root causes. Right. Thank you guys for being so engaged. Understanding how qualitative versus quantitative data is. Yes, definitely. I'll make sure I hit that. Getting planning committee engaged. Creative ways to select data. I'm looking for more concrete ways to engage the faith-based communities. All right. And as I'm talking about this, you guys are all experts too. You're working in this. So as I'm talking, as looking at marijuana and faith-based and talking about engaging youth, whatever ideas you have to share for the greater of the group, please do so in chat, because we're all a learning community together. You see some of these last one, how to make this sound exciting, the coalition. So they join my short-term action teams. Yes, definitely. We're going to be talking about how we can do this through storytelling, which is my favorite way to do logic models, so that it is something super engaging for your coalition. Thank you guys for being so open and sharing the chat. I truly appreciate it. So you've seen these before with National Coalition Academy. And the reason I bring this up is because it is so important to figuring out where we are. And I wanted to keep encouraging you that these are living, breathing documents that should be woven into the work. We shouldn't be dusting off our old community assessment or old logic model. And it should be something that we're looking at every single day. And if we're starting a new activity, whether it's because we're looking at changing a local condition or we're building capacity, one of the two, if it's not related to our logic model, we have to stop doing it and go back and say, do we need to revise the logic model, or do we need to stop doing that activity? Right? This is truly about making sure every movement we make is strategic and intentional. Every time we're making a decision about an activity or bringing a stakeholder, we know where it fits so that we're having impact, making really strategic and intentional choices. You'll hear me say that a lot today. So by using the milestone, this is really, to me, the first step into making sure you're weaving the strategic prevention framework throughout your work on a daily basis. So it doesn't just become something I look up every year or 2 years or when my funder tells me to. That's why I love starting here as a great way to say, okay, this is how we can start weaving this into the structure of our coalition, so we're always coming back to it. So today we're going to be working in 3 of these capacities, the content I'm going to be showing you today. So of course, we're going to be talking about creating the logic model. Absolutely. Logic model webinar, right? So we're going to be working towards that area of the assessment. I'm also going to be talking about building capacity quite a bit and how you can build capacity through working on your logic model. Dorothy and I always jokingly say when we're doing this that we really feel like capacity should be in the center, because at every stage you should be thinking about how you build capacity for these. And so I definitely will be talking about how we can engage our stakeholders in this process to get real buy-in and credibility in the work we're doing. And then finally, we are going to be talking some about strategies, because the logic model truly is the foundational piece to making sure we have outcomes at the end. And those outcomes are driven by the fact we're going to have these layered strategies that have real impact. So I'm going to be giving examples of how we can really layer those strategies to have that maximum punch to that local condition, so we can start seeing that community level change we want to see. So we'll be working through an area of the assessment, the logic model, building capacity, and then finally with those strategy piece and the strategic planning. So we'll be hitting 3 of these areas in the content today. So the logic model, as I told you, this truly is our roadmap to success. It is the foundational piece in all the work that we're doing. And as I mentioned, if you are doing anything that isn't rooted in your logic model, you need to ask yourself why you're doing it, and if you need to go back and look at your logic model. And I know that sounds kind of like super strict and crazy, but I'm telling you, the more you do that, the more impact you're going to have. Your strategy is going to have that impact. You're like, okay, everyone says we need to do a health fair. Everyone says we need to do this forum. Where does it match? Where does it fit in the work we're doing? And if you're currently at a place where you haven't been using your logic model as your touchstone for the work you're doing, this is a great time to sit down with key stakeholders or your coalition meeting and say, let's write down everything we do. And this is an activity I fully recommend every coalition doing. We did it for the first time, I think it was like year 1 or 2 of our drug-free communities grant after we had had state funding. And it was mind-blowing, for everyone to see all the work that happens in our coalition, every area we're involved in. But then it was also great to take a minute and say, okay, what do we know is working? What have we actually evaluated and tracked in all the little activities we're doing that we know is working? Where does it fit? Are we showing that we're actually hitting those local conditions or changing anything in our community? And if not, what needs to change? Do we need to stop doing it? Do we need to make sure it is tweaked to fit? We want to make sure that we're always thinking about where can we get real impact? Where can we make sure we're doing it? And so if, like I said, if you're in the midst of, we already do a ton of stuff and it isn't mapped to a logic model or our plans, sit down and really just think about all the work you do. It's a great way for the coalition to see how much work is being done. And then sit down and think, what can I prove has impact? What is part of a layered group of strategies that is really working towards our end goal at the end of it? And I know you've seen this, but I want to start here before we get into what I'll talk about storytelling in the logic model. And that's that criteria for moving from that informed brainstorming process of problem analysis to developing our logic models. I want to start here because this truly is where you can engage your coalition in the work. That informed brainstorming process, and we're going to talk about it in a minute more, is such a great way to get stories and understanding and buy-in from your community by soliciting their experiences in this, right? To start asking them, what do you see? What's happening in your community? And then you're able to take what they're talking about and find the data, help you find the data by them going out and doing it, because they're the ones who are saying this is an issue in my community. And so in order to move from that informed brainstorming to the logic model, of course, we want to see that data piece. We want to be looking at those root causes based in prevention science. We're going to go over those again. Making sure those local conditions are strong, specific, identifiable, and actionable. And we're going to go through each one of these again, I promise. And that again, I love that someone spoke already to community readiness, that your community is ready to do something about it. It is consistent with their experience and expectations. They see that this is an issue and they're ready to take action on it. You can have a beautiful logic model, everyone. It can be textbook perfect. And yet, if no one wants to do anything about it, it doesn't matter how great it is. So we really want to have a logic model that, yes, makes sense, has the data, has the line logic, but also that your community is ready to take action on. And this came up with me when we were struggling with a meth epidemic in Tennessee when I was working in my coalition. We were very much rooted in 12 to 24-year-old population. Our coalition was making real movement in the prescription drug issues we were having in our community. And it came in and people were like, we need to be taking on meth. A lot of the outside law enforcement were like, you should be looking at meth. And my community wasn't ready to take that on for the age population we were working with because they were really vested here. So it wouldn't have mattered if I sat with them and made a great math logic model. They weren't ready. 2 years later, they were. And it wasn't that we didn't do anything towards math. It was just for our age population, that wasn't an issue at the time for them. And so making that pivot didn't make sense. And so we really need to make sure that as emerging trends come up, that we're ready to do something about it and that we're encouraging our coalition by giving them the information they need, not just doing something to them, as we talked about. We want to do it with them, not to them. And so part of our job is bringing them along on that. So I want to talk about breaking down the big picture. And if you've been in any of my cohorts, you know I say this. I'll keep asking you, just tell me the story. And I want you to take that back to your coalitions, because I think a lot of times we get really caught in, okay, we got to go back to logic model, everyone, we're going to logic model. And let's be honest, even to someone who's in the field, logic model can seem scary and overwhelming. So when we go back and say, you know what I want to do, I want to know the story of what use looks like in our community. Tell me what you're seeing in the high school. Tell me what you're seeing when you're going out on Friday nights. Tell me about what use looks like. Let's have this conversation. Let's turn it into a story, because that's what this really is. Your logic model and your assessment are the story of the use in your community. And I know we get bogged down in the data, and it is absolutely important. But when we start here with having coalition members tell us these things, then we can go back and be like, okay, how can we prove that? Who can we talk to? Where can we pull this data out? But starting at tell me the story really helps us break down the barriers of people feeling like they have to have a PhD in this to help us. And this is what I mean by this. This is something we did with our coalitions, was turn what was our logic model into an actual cartoon graphic. And when we were really starting to take hold of trying to incorporate logic models into the work we're doing. And so this is one of the ones when we're talking about prescription drugs that we showcase. So man, I want something to take the edge off today, but I don't want to do anything illegal. And remember, this is from 2009 when the prescription drug issues first started in our community. Well, let's see what kind of pills we can find in my grandparents' medicine cabinet. They have so many, they won't know they're gone. These round ones may be painkillers. Let's give them a shot. I feel horrible. Hey, I got something that can help you. I think try one of these. Okay, thanks. That was 2 days later at school. And looking at this in chat, what is the drug of choice that we're talking about within this context of this story? Opioids, prescription drugs, RX drugs, yep. And what do you see the two main issues are in this scenario? As you're thinking about these kids, what are you seeing are the two main issues? So they have drugs, definitely. RX drugs is the drug of choice, opioids, prescription drugs. Now, from the rest of the story, what are the two main issues that you're really seeing here? Lots of access, yep, accessibility. No idea what they're taking and not caring. Yes, absolutely. Yes, Tina. Yes, availability and their perception. Those are the two things we're looking at right there in that story. Pain and coping. And those are coming, and we're going to talk about it right from our data. That's how this was built. So the idea that access, number one, you guys all got, and then perception, the idea that they don't think there's anything wrong or that it would harm them to take these drugs that they know nothing about. How are they using? From what you're seeing from this, how are they using? Where are they using? When are they using? What are some of those kind of things you're seeing in this maybe? It says later at school is the end part of that one. Friends at home and school, yep. And see how just in this one story, we're really starting to break down into our logic model and where we can collect data from, just in this one story. And of course, we need to corroborate it with evidence, which we did, but we really are able to start to see with just having this conversation and putting it in this format where people can really latch on to what we're talking about when we're saying breaking down what's happening in a real behavior way. Right? So what is the drug of choice? That's our problem statement in our logic model. So right now, we just said in that story that RX drugs, opioids, whatever, we have to get the data to back it. But we know right now in that story, we can say, okay, the drug of choice is RX drugs or pain, depending on what our data is going to say. What are the two main issues? Opening to use. So that's the root causes. And see, these are the root causes that are back in prevention science that you've seen, National Coalition Academy. And so, right, immediately you guys got it. Availability, absolutely. Social availability, key, right there, getting it from the grandparents' medicine cabinets, right? And the second part was the favorable youth attitudes, right? But there's that low perception of risk. They're like, I don't think anything's bad. I don't think it's as bad as any other type of drug. So this is safer. And this was very early on, like I said, and when we were still really struggling with the perception that prescription drugs were safer than other quote unquote street drugs, right? And so we were really tackling that. So this is really what it looked like at that time in our coalition. We can see how we take this story and are able to pull out what is the start of a logic model. I'm going to stop for a minute because I do see something in Q&A. Oh, thank you. I see that you're answering there. Yes, there are no adults around them. Yeah, and this also lets us start to see maybe where we can intervene with strategies. And we're going to get there. So I'm going to pause there because a lot of you did start saying like no adults. And some of the strategies. We're going to get there too as we follow this along. So the drug of choice is the problem statement. The two main issues that we're seeing opening to that use is the root cause. And then the how youth are using when I ask those final questions. Where, when, with who, what does it look like on the ground level? That becomes our local conditions. And so what we saw here, and you guys illustrated very well, is that youth are stealing prescription drugs from their grandparents' medicine cabinets, and youth are sharing prescription drugs with friends at school. All of a sudden, we're able to see through this story a layout of a logic model that we can have real impact in, especially once we have the data to back it up. And that's what we're going to talk about too, how we did that. I want to stop here too, because I know a lot of you have struggled with this and all the cohorts, is what if it fits in two places, right? And that's what I'm showcasing here. This logic model we're starting to map out from that story. It starts with the idea that it's prescription drug misuse is our problem, which we saw. And we all talked about availability is an issue. We had the fact that youth are stealing from medicine cabinets as grandparents' medicine cabinets. And then we have youth sharing prescription drugs, which could definitely be availability. But then as we talked about, we also would fit under favorable attitudes as well. Has anyone had this issue where they're looking at a local condition that could fit in either one of those places and they're struggling with where does it go in their logic model? You say yes or no in chat. Carrie says yes. Casey, sorry. Oh, yes. Yeah, this happens a lot. And this is where you'll hear us say a lot of times, this is where art meets science, right? I can't tell you, right, just automatically which one of these is the better place to put it because I don't have the data yet and I don't know your community. And that's where this is, local conditions are local. If you've seen one coalition, you've seen one coalition in one community. And so this is where we need to go back and say, hey, what does it make sense in that picture? And as we already talked about, it was them in that conversation having a discussion about the idea that it was safer, or they didn't think it would be a problem with sharing that prescription drugs, which points to a favorable youth attitude in our community. And that's what we were able to back it up with our data. And we started looking at and talking, putting it into our surveys, the kids are saying they didn't think it was as dangerous, and that that's why they were sharing it. And our data was showing that they were sharing it because they thought they were helping each other, that they were sharing medications. We had 66% of our suspension and expulsions in that year at school were due to sharing prescription drugs at school. And when we did focus groups and talked to those kids, they were saying it's because they thought it was safer. So it wasn't to get high and they were using it and buying it or sharing it. It was literally because they thought it was okay and safer. And so that points to, for us, made sense to put it with youth favorable attitudes. Whereas it could be in another community that the issue truly is just availability. There's enough of it. It's just that they're all taking it, and it could make sense when you look at your data that's going to go under availability. And so if it fits with both, as I was saying, these are some of the questions you can ask yourself. So these are a good money slide as you're going back and looking at slide 12. If it fits with both, what are some of the things you need to ask yourself? Does the data show low perception of harm or high favorable attitudes? What is the data telling you in terms of why they're using? Or does data illustrate sharing as the first source of availability? When you talk to youth about where they're getting it, are they saying they're getting it from their friends first? Or are they getting it from the parents' medicine cabinet? So really talking again, what is the data saying to you? And getting to the core of why they are sharing. For instance, when we started talking to it, it literally was, and when we were talking with especially our young girls, because our prescription drug rates were equal in use for males and females, which is different because usually you see higher risk taking in most of the other areas where boys would be higher. And it really was because they were sharing for pain or for emotional issues that were happening. They were sharing medications, what they thought was helping someone cope. And so that really does point to a perception issue. And then also you have to take into consideration, where are you going to have the biggest impact? What can you do something about? Is there one that has a higher concern area than another? Is there one that you currently have more capacity or more ready to make change on? It might be that your community right now is like, availability is the issue and we want to tackle it that way. And then that's the way to put it, as long as you have the data to match it. And so these are the two things: bring it back to the data, where does it fit? And then also think, where does my community want us to go? What is making sense for what we can handle right now with the work that we're doing? Double checking Q&A in the chat. So when we're thinking best fit, as I mentioned, that was just a screenshot again of us going back through it. It really is about the idea that for us, when we look at the data, as I mentioned, it makes the most sense to have the youth sharing prescription drugs as the local condition for youth favorable attitudes. And then it causes us to go back and say, okay, let's talk more about availability. Where else are you getting prescription drugs? Let's have this conversation. What else are we seeing? What behavior are we seeing? Because youth think it's okay. So they're sharing prescription drugs at school, but what else are they doing? Because they're not afraid of prescription drugs, so they don't think there's going to be harm. And so this allowed us to go back and again, start looking and talking to our coalition members about what else is going on and what data that we could get to talk more about this. This truly was the start of our logic model, just in having a conversation, sitting one-on-one. And I saw up in chat, there's something about, sorry, I'm scrolling back up, about problem analysis and doing this with your coalition. And this started, that story started with the problem analysis, and we worked with them to move it into the logical model with data. And so what we did was literally take groups of people and had key stakeholders that were familiar with logic modeling and problem analysis process. And so we had a group coalition meeting, about an hour and a half, had people in groups of 4 to 5. And then we just said, okay, we know we're having an issue with prescription drug misuse. Let's talk about it. Tell me stories. What's going on? And literally we just had people with whiteboards writing down everything people were saying and then mapping it out, and then saying, okay, great, I heard this story. So it really seems like most of you are talking about availability and from grandparents' medicine cabinets. how can we get information on this? Who has information, data on this? Can we get with law enforcement? Law enforcement's in the room at this time because we made sure we had all our stakeholders and really started to map it out. But it truly just started as a conversation in small groups with a whiteboard in the background and us writing it down to really map this out. They don't need to understand that it's problem analysis. They don't need to understand that you're logic modeling. Some of them do that are facilitating it. For the rest, it's truly about, can we work together and do this in a way that makes it a storytelling session so that you guys can get what you need out of it to move it into a credible logic model. I see that there was a hand raise or question. Does someone have a question? Looking in chat. Feel free to tap and type it into chat.
I don't see anything in chat right now about it.
Okay, perfect. Oh, it was an accident. Thank you. Appreciate it. All right, I have to come back here because this is my favorite part of local conditions, and you've heard it over and over again, but I really want it to sink in with you. Is that, but why here? And again, even when I work with coalitions, I go in and tell me the story. What does this look like? So that you can get this as specific, identifiable, and actionable. When I say specific, I mean taking it from a thought bubble, an idea, to an actual behavior. So instead of saying, parents just think it's okay, because parents think it's okay, what are they doing? They're hosting parties, they're buying alcohol, they're vaping with their kids. Whatever it is, we need to get it from this thought bubble to this actual behavior that we can do something about on the ground level. We also need to make sure that we can measure it more than once. So if someone is saying something's happening in the community, we need to go back and be able to say, okay, we see it with law enforcement. Law enforcement has said in their reports that they're seeing it this way. We've got kids saying it's happening. We could go back and do it 2 years from now or 6 months from now and look at the data and figure out this is still occurring. And of course, that it's actionable. We can do strategies around it. It's something local enough that we can intervene in. And I want you to keep coming back as you're looking at your local conditions and revising your logic models to continually ask yourself, but where, but when, and on what occasions? And I want you to get that specific. If you can get it as specific as at, Leominster Beach with, they're having pig parties during the summer, that is how specific I want you to get it, because then we can do something specific with that beach and change that local condition. We want to continue to unpack and unpack until we get lots of these little pieces that we can have true meaning in that have the maximum impact later on. And so that's why we keep going, okay, break it down, break it down, break it down some more. Because anywhere in all of the United States and the world, we could say rite of passage is an issue. And it absolutely is. But what does rite of passage look like in Coffee County, Tennessee? What does it look like in your community? And that's what we need to get to, because then we can start to do something about it. Rite of passage is a huge elephant. We got to break that down so that we can really do something about it. And this is where that happens in the local conditions. Right, I'm looking in chat.
So Jessica asked, does anyone have access to focus group questions to use for youth, law enforcement, school admin, or teachers?
Absolutely. CADCA does. And your week 1 workbook has a lot, as well as your workstation under assessment and shared resources. There's a ton of them, but always you can call CADCA to see what they have available for you and to assist, as well as if you're part of the CADCA community on forum, putting that question out there, Jessica, you will be amazed by what coalitions are willing to share with everyone. But on here as well, anyone who has that, please do so. But yes, you have lots of options for Jessica. So please reach out to CADCA. And again, on your workstation in shared resources under assessment, there's a lot of great options as well. Thank you, Brittany and Jessica. All right, and a little tip for going back and doing this. Provide your coalition members with key data points and ask them to draw what it looks like in your community. This is one of the things we did. We were working on 3 major issues we were working on at one time was inhalants, prescription drugs, and alcohol. And we literally had 3 by 5 cards that we wrote data points that we knew we had already found that were issues in our community that we knew would highlight what was going on. So some was 30-day use rates, some were some key informant interviews or focus group, but just one data point on each of them with the front side saying that like inhalants, prescription drugs, or alcohol, and the other side having one of those data points. And we let the coalition members in their sector team, so like law enforcement together, school system together, take time and look through that data together. We call this Scan, Focus, Act. They took time, 20, 25 minutes to look over these pointed pieces of data, about 10 in each group, so 30 pieces of data total, and really start to look at it and then draw that story to them, have a conversation about what it looks like, what they've heard, what they've been seeing in their sector, and draw out that story. So then they can present it to the whole of the coalition and say, this is what we're hearing, and then have a conversation about where we get additional. Because then you don't have the data yet or a good grasp on the local condition. You can provide them with the root cause and problem data, and then they might uncover all the local conditions. So it might be that you have 30-day and a lot of the perception issue, but you don't have those local conditions. This is a great way to flush that out. Have them start talking about it and then be like, great, so you're seeing at a bus stop, there's use happening. How can we get data around that? And law enforcement will be like, great, you know what, we'll put a car out there and we'll do an environmental scan for the next week and see what we're seeing. And then someone else will be like, we're going to talk to students on the bus and see if they've been having any issues. Is there any reports to the school? This is where we can truly start to flesh out those local conditions and get them super specific, because we're involving everyone. So now we're going to get into the data questions. And so please, as I'm going through this, I know a lot of you have the questions about data, and I want to be able to support you in any way I can. So as I'm saying stuff, if it's triggering more questions, please go ahead and put them into chat. For your logic model, we want to see 2 pieces of data in each element. And again, this is to back it up what's happening. We want to take the story we heard that we're seeing traction in and then back it up with these data. And we want to, because remember the triangulation of data, the idea is that we don't just want one student survey across the whole entire thing, because that just means that student survey said it. But we want to be able to say we're great detectives and go back and say we really diagnosed this in our community, right? This is what we're seeing is happening. So it's not just that we just did this one test, this one survey. We went back and we talked to law enforcement. This is what they're saying. We talked to focus groups. We talked, and I know there's a question in chat about quantitative and qualitative data. And we do want to have both of those. And what I'll say to you, it doesn't matter how long your coalition has been around, whether you're year 1 or you're all the way a 20-year coalition. When you get to the local condition data, we're always going to be seeing more qualitative data because it is so ground level, because it is so nuanced. We are uncovering things before we know to put them in a survey a lot of times here. Sometimes it's emerging trends. Sometimes it's just so expensive, like parents drinking at high screens. We might not have that data and need to go back and get it to prove it. So there'll be more qualitative data on that end of the spectrum from the local conditions. So we want to see a mix of both throughout this. It doesn't have to be one is qualitative, one is quantitative, each one, but we do want to see a mix. Again, this is your roadmap. I always say this is the beginning of succession planning and leadership planning, is having a logic model, because everything you're doing is in one place, right? This is what you're saying the problem is, what you've diagnosed are the issues in your community. And you can hand it to anyone and see exactly where that data came through to back it up, and that you're able to collect it multiple times. We want to be able to go back to the source. So I brought up the idea of the bus stop that we were seeing in our community. And this came out of one of those problem analysis logic modeling sessions we had later on. And someone just kept bringing up that we need to do stuff with the buses and the school system. We need a program for kids because of what's happening on the buses. And I'm like, okay, what's happening? Can you tell me the story? Like, let's get down to this. You're very intense on the fact that we need a program in the schools and it's due to what's happening, but I couldn't unpack exactly what was going on. And so finally she said, like, I pass this bus stop every day. I know some of my family friends, kids who get on the school bus, and adults are soliciting them for drugs or trying to sell them drugs at this bus stop. And it was one specific bus stop in front of one of our convenience stores, one of our back streets. And we wanted to be like, great, well, what's going on? Can we go back and look at it? Can we see it multiple times? And we were able to engage law enforcement and the schools in collecting that data and being able to do it in a way that we collect it 6 months from now. And just from that conversation, we're able to map it to the logic model, map it to what was happening with prescription drugs, and then do something about it to make sure that we're keeping those kids safe. And so that's why we want to make sure that we get it as local as possible and that we can collect it multiple times so we can show that we had real change there. And then you'll hear, I'm going to look in chat because I see a lot going on. But then we also need to make sure we have our data really, really succinct there so we can go back to it with the measure, whatever that question is on the survey, the 30-day use or where you get your alcohol, the data, the actual number, so 30%, the source, what is that survey called, or what is that focus group called, and the date. And hopefully you have the month and the year, but at least the year there, so that people can go back and collect it those multiple times. So when you go back and look at your logic model, again, we want to make sure that we have data that backs up the problem, root cause, and local conditions. And the data actually says what's in the problem, root cause, and local conditions. So if we are saying that parents are partying at high school football games, the data points illustrate that. They're not just saying that parents have alcohol. It's literally saying that parents are at high school football games using alcohol. We want to make sure it maps. So if we do something about that local condition, we're going to see the data change. That again, we have super specific local conditions that we can take a picture of, that we can continue to measure and we can do something about. That we have line logic, that we can read it from left to right and right to left. I'm going to go through that more. And again, I'm just going to keep saying this, that it reflects community conditions and concerns. Again, you can have a beautiful textbook perfect logic model that doesn't mean anything if no one wants to do something about it. And that's where that community readiness piece comes in. And that's why engaging people in the process is so important. We don't want to do something to them, we want to do it with them. And I've already said that, but it's really important. One of our jobs as key stakeholders and coalition leaders is to be the listening ear. And so we need to make sure that we're involving this in the process. So they're not just showing up at a meeting and saying, okay, this is what we're going to do. They own it because they were part of it. They signed their name to it when they were going through that process. And so then they start to think about it. They start to involve it in the work they're doing. That's really what we want to see. And so that's why it's really important to start here, involving them in this work so that they really own it and want to be really part of those strategies and invested in them. So talking about critiquing logic models and how data works. You see here, I'm going to start with local conditions about why here. We're saying here that retailers sell alcohol to minors. It's an issue, right? We have data that directly says that, right? So 15 of 60, so 25% of retailers in ABC County failed compliance checks in 2019, and that came from the alcohol dealer. That right there tells me retailers are selling alcohol to minors. If we stop retailers selling alcohol to minors, we do something to contribute to that stopping, we're going to see compliance checks on the failure decrease. The second data point is you cited for minors in possession, or MIP, report access from retailers, 2019 ABC interview. So again, we're hearing directly from police who have talked to youth that is where they're getting their alcohol. So both of those data points back up that retailers are selling alcohol to minors. Availability of alcohol. 46% of 8th through 12th graders report alcohol is easy or very easy to get from the ABC survey in 2019. They're saying right there in that data point, the alcohol is easy to get, pointing to the fact that availability of alcohol is an issue. And then that second data point is youth report alcohol can be easily obtained. 2019 focus group. Right there in the sentence, we're saying that alcohol is easy to get, backing up availability. So if we're able to impact retailer selling, we're going to see those two data points change. And then we're going to see availability of alcohol change and those two data points. See, when like everything needs to map and line up so that we can prove the impact we're having. And then finally, underage drinking on the problem statement, 39% of 8th through 12th graders report use of alcohol in the last 30 days from the ABC survey, backs up that underage drinking is a problem. And then here, the second data point is 32 citations for minors in possession in 2019 from the ABC Police Department. What I love about this is this is a consequence. It absolutely points to there's an issue with underage drinking. So it maps right back to that being the problem statement. But I also love that it's two data points in the same place on this line of logic, looked at in a different way. So under the problem statement, you see that the consequence of the idea that minors are being cited for having alcohol. And then under the local condition, you see within those reports that they acknowledge the fact that they were getting it from the alcohol retailer. So talking to police, you can get the minors in possession number and then ask them what's on the report. What are they reporting that they're saying they're getting it is a second part that points to the local condition. So that's what I want to showcase that, because sometimes I think we feel like we need to go in all these different places and continue to collect data and continue. And right here, it is one conversation with law enforcement and they already have that data from looking at minors in possession.
So Christina,
Go.
Tammy had said, we have temporarily lost a lot of our qualitative data because of the pandemic, and our own attempts to collect a sampling are at best lacking because our sampling is so much smaller than the permanent one. I would feel better temporarily using qualitative data than our small temporarily sampling of quantitative. Would it be okay to temporarily just use qualitative until we have our better, I'm going to assume this meant we have our better quantitative source?
That's a great question, and a problem a lot of coalitions are having right now. And I actually have a slide coming up on data collection during COVID. So what I will say is we want to have a mix. Yet qualitative data is absolutely needed. There's other ways to have quantitative data that isn't a student survey, which I feel like is what you're talking about here. It can be still some of the archival data. It can be some of these percentages of retailer selling. There's other ways to have the quantitative data filled that doesn't relate to a student survey to match with your qualitative that you're seeing maybe in your focus groups. I will say one of two. This is what I've seen done, and either one works. Either continue to use the one that you have with the understanding that you need to have an asterisk saying, we know that this isn't a perfect sampling because it happened during COVID. Or like you said, have a COVID-19 one in which you're using the very best data you have of qualitative and quantitative data that's from archival data or from compliance checks. And so it's really about what can you guys get behind. If you are not comfortable as a coalition with what you have in that small survey, is what I'm guessing, like a student survey that you're doing, then go ahead with the youth focus groups and listening session and fill out some other quantitative pieces that are coming from some of that consequence data, some of those compliance checks, maybe some law enforcement or judicial ones that you can better fill out some of that aspect too. But that's definitely an issue, and I am going to talk more about that, but especially with the student survey, if you're not comfortable and you don't think it's a good sampling and you don't just want to say it's your COVID-19 logic model, go ahead and do another mix of quantitative using those other sources, as well as doing focus groups and listening sessions to get some of this information like 30-day use. And then knowing that once you get that data again, because again, these are living, breathing things. We talk all the time, it's a date, not a marriage, right? It's living and breathing. So then once you next year are able to have a solid, well done student survey, going back and looking at your logic model and tweaking it appropriately. This is what's really important. As new data comes out, you might figure out that that local condition wasn't in reality the number one we need to be working on. That's when you go back and say, okay, now we need to switch this. Or maybe we need to add a third local condition to availability. So I encourage you to go back, have that discussion with your coalition and figure out what makes the most sense for you. And if you're not comfortable with it, find those other data sources to fill in. It totally makes sense. And I would, again, always put that this is our logic model we developed during the pandemic. And I think that's really important for people to note as well. See, Sammy, you set me up for logic models and data collection during COVID-19. There's a lot of different things we can do, even if we can't have the student surveys we're used to having that have such solid data in them. You can do the environmental scans, as I was talking about, and that's a great way, whether it's counting price and promotion issues, whether it's going by hotspots and seeing like the bus stop, seeing if there's any loitering or people soliciting your children, things like that. Archival data collection. When you go back, let's get our law enforcement, get our hospitals and medical professionals together and say, what are some other ways we can collect data? Do we have some DUI checkpoint information, compliance checks information, ER and opioid overdose information? What are some other things happening that we can collect data on? Being able to do listening sessions, getting a group together, whether it's at your coalition meeting, whether it's getting a group of youth together, whether it's getting, for us, when we first started tackling prescription drugs, it was pulling together nurses, pharmacists, veterans, dentists, anyone from the dental field, any type of medical professional together. And we did over 3 days listening sessions where we asked them questions, got feedback from what they were seeing, and were able to get data. At the time, this was before we had all the monitoring systems, how much was being prescribed out of our local pharmacies, what they were seeing in terms of use, what they were worried about. So having those listening sessions is really important too. Coffee talks or story drives. Again, the idea of just getting together and talking, what's going on? Let's stay with the pulse of what's happening in our communities and having those discussions with our community members. Making sure that there's different ways that we can share with each other, whether you have Google Drives or Dropbox. There's lots of different ways we can still collaborate, even if we're not together, and make sure people have the list of things you can do an environmental scan on. And then other things like, you haven't tried Mural, the way of facilitating this discussion if you can't be in person yet in your community, that, as I was talking about, problem analysis or logic model gives you the Post-its or jams on Google where you can be like, okay, you just said that you saw kids at a bus stop. You just said people sharing, and make those different Post-its. You can facilitate it online. And then Padlet's great if you want to do that community mapping where you're talking to a sector and saying, okay, we're going to meet with law enforcement at 12 on Zoom. Tell us what you're seeing in the community. Where's use happening? Where do you see we need most help? And then the next day being like, okay, now we're with health professionals, map it out on here. And then it kind of layers together so you can see what's really happening. So those are two kind of tech things to utilize as well. Mary Catherine says, do you have any guides or resources for community members who are going to conduct foot or car-based environmental scans? Yes. So definitely I will pull some off of the workstation, another area of the workstation, and shared resources under assessment. You will see a lot of those. Also, week 1 workbook has a listing of environmental scans in the back, and then CADCA can definitely get them to you as well. But I will make sure to pull some that when Brittany puts the resources for the PowerPoint to you guys, I will make sure to also have those connected, Mary Catherine, so you have them. But yeah, really great question. Environmental scans are really powerful and a great way to get people involved. We did them for when pill mills were really big in our area, and we were having a flux of, we were finally getting control of them, but we saw kind of pain clinics popping up that were saying they're urgent care. And we were able to send out our coalition members 3 days a week over a month time span to be looking at the parking lot, seeing what kind of license plates were in there, were they from out of state, when they were seeing more people were there, to figure out for our law enforcement which ones seem credible and which ones maybe need to have double check that they actually had some type of license for the work they were doing. So really powerful way of getting people involved. Okay, you're going to send youth out into the community to look at alcohol advertising. Absolutely, we can definitely see what we have on that. It's another great way, yeah, absolutely, to get youth involved.
So Melissa had also asked, one of our local conditions is drinking in the school parking lot during lunch. The challenge is that behavior still occurring. Our schools were hybrid and remote most of the year. Can you speak to this?
Yes, absolutely. This is where living and breathing document, y'all. This is where it changes. Right now, if that's not what's happening, go ahead and take a pause on that logic model and go back and say, what do we need to see what's happening right now? We saw a huge shift during COVID in Tennessee, and I know in a lot of your states as well. We were allowing alcohol to be delivered. We were allowing to have, you could get drinks to go, which we had never had before. All of those things dramatically change the way you can access alcohol. So yeah, we absolutely need to go back to the drawing board and be like, okay, let's talk to law enforcement. Have you seen that youth are getting this way? Let's talk to her, have a listening session, ask our youth, have you been able to get alcohol delivered? Have you seen that happening? Because we need to. And there's one or two ways you do this. You could pause that one logic model and create a specific one for this time of what's going on, knowing that this probably will become an issue, your other logic model again, once everyone's back in school. Or you can go ahead and tweak that one logic model that has that, take that local condition off for now and place one that is related to COVID-19. Because we want, our job is to make sure that we're diagnosing what's happening currently now. If we don't do that, it's like treating a disease that isn't happening, right? If I don't have a rash right now and I keep putting cortisone on, what does that mean? And I have something else happening over here. And so if that's what's happening, if it's changed, that local conditions change, right now, you need to make sure that local condition matches what you're seeing and go back out and start asking those questions again. And that's why, again, your local conditions will have a lot of qualitative data, a lot of you having listening sessions, key informant and environmental scans, because things do change so quickly. You're not going to be able to add delivery of alcohol to your student survey right now. So I encourage you to, like I said, do one of two things: either put that logic model on pause right now, knowing that once they're back in school, it might look that way again, you just double check it, and create a COVID-19 one, or go ahead and start changing that one to meet what's happening currently in the community.
Mary Catherine had asked a follow-up question. Is there a template for how to train the community members to do this observational work and protocols we should be aware of?
That's a great question to ask CADCA about in terms of data collection. Yes, we have every single one of them has instructions on it that I usually pull to give you guys, and I'll double check that. But we can find within the community where they've mapped that out in terms of going out and doing that, particularly for alcohol. When we've done it, there's using youth, there's much more like kind of background instructions on how to do it. When it comes to driving around the car, it's just asking, making sure you have written down exactly what you want them to do and the time and date you want them to do it. And those worksheets that we'll provide will have those on there. But that's a great question. So now I'm going to get into strategies, and please keep asking questions about, I'm telling you, this is a crux. If you want to see impact and change your community, starting with your logic model and making sure you continue to ask yourself, is what we're doing connected to a local condition? Is what we're doing either connected to a local condition or capacity building? Because if it's not one of those two things, we either need to stop doing it or change our logic model. I want you to keep coming back to that because it's powerful. Our idea of why this is so impactful, what we're doing is if we can take parents host graduation parties with alcohol and map these 7 strategies that are layered and comprehensive, they work together. So we're not talking about one thing about retail access in here and then talking about social hosting. All together, every single one of those 7 strategies is going to do something to impact parents hosting graduation parties. We will be able to push over that domino. We're going to change that condition, that data about parents able to host parties with alcohol, which will change favorable parental attitudes and in turn lower underage drinking rates. And that's why this is so important. If we can get as specific as possible, that we can nail parents hosting graduation parties and change that local condition because it's so specific, it allows us to go on and then find the next local condition, next one, and we just keep building up momentum to push over favorable attitudes and then underage drinking. Because if we can change people's behavior, we can change that thought bubble of parental attitudes later on, which is that root cause. This is when we think about this, I always go back to seatbelts and even tobacco, but I'm going to talk about seatbelts now. For a long time, not that long ago, we didn't have car seats for kids when you left the hospital. You didn't have to have your seatbelts. I mean, I even remember still being in the back of station wagons, not always having my seatbelt on. And then you saw we changed the law, right? We started to had campaigns about it, changing seatbelt laws all across the United States. And now it's second nature. We went from, even if people didn't like the idea of seatbelts, they were still buckling up because they didn't want to get in trouble because they knew it was safer, right? And so we were able to change behavior first of people buckling up to then change their perception that it was something that would keep them safer, and then decreasing accidents really is what we're looking at, and deaths. And so that's where we want to get to. We want to find those places that we can change people's behavior first. We get them to do the actions we want them to do, even if they haven't totally bought into it yet. But then we'll change their behavior as we do enough impact around it, and then change the overall issue that we're having. So I like to take it out this way and think about health, and we want a healthy life. So I want you to think for a minute. I have some of them listed here, but I'd like to hear from you. What are all the things you've heard of that we need to do to be healthy? What are all the different things you've heard of to be healthy? If I came to you and said, you know what, I'm not feeling great, I need to have a healthier life, what are some of the things you would tell me I needed to do? Chat. How can I get healthier? You tell me to exercise. You tell me to drink more water. Some of the things are like maybe eat healthier. Take care of yourself, stress management. Take some time to relax. Ooh, meditate, mental health days. Can I have one of those? Yes, please, Gwendolyn. Get sleep and do things that are enjoyable. These are all good. Moderation, sleep. Yeah, absolutely. Right. So you guys are taking even some things I don't have on there. Time for yourself. Yes, absolutely. Drink more water, eat dense food, have time to yourself, good diet, stand more, learn new recipes. All of these things. We have a ton of strategies that we could do, right? Now, what if I told you that I'm a new mom, I have a new baby, and I'm not getting any sleep, and I'm stressed out? What are some other things you might tell me that are different than what you just said? I say I'm a new mom with a child that's not sleeping. I got an infant on my hands. What are some of the other things you might tell me if I change it to that? Ask for help. Sleep in the child seat, ask for help. I love the ask for help. You can tell the mom, accept help for those who offer bedtime routine. Anyone else? This is why getting as specific as possible is so important in our local conditions. Because when I tell you I just want to get healthier, you can list out a ton of things. You can tell me I need to go and exercise. You can tell me I need to eat right and everything else, and that's going to make me healthier. But then when I tell you, get more specific and say, I'm a new first-time mom who has a baby who's not sleeping, all of a sudden it changed. You're not going to be like, you know what, you need to learn new recipes. Like, you're not going to say that to a new time mom because that's not going to help. You're saying it. You need to reach out. You need to ask for help. You need to have fellow moms. You need to come up with a schedule. All of a sudden it changed from you need to make sure you have mental health days, which is true of being a mom too, of course, and telling me to eat right and telling me I need to exercise to being like, wait, hold up, this is this is why it's so important to get specific, because we went from all of this that might have not helped me or impacted whether or not I'm going to get healthier to being really specific to what I need as a new mom with a baby who isn't sleeping. And that's why we need this, because we want every single strategy we want to have impact on that local condition. And the reason I have this picture here is because this is the way I like to visualize it. We want all the strategies working together to pull over this logic model, to change all of that data that we're seeing. And if we're doing a tug of war and we have one strategy pulling this way, one guy pulling this way, and a girl pulling this way, someone else pulling this way, we're not going to pull over, we're not going to win. But when we layer them together that are interrelated and we're all pulling into the same direction, we're going to see maximum impact. And so if I was just saying I need healthier, and I have one person pulling over here because they're saying eat healthy meals, and another one pulling over here because they said I need to learn to cook better, that's not going to do anything. But once we hear that I'm a new mom and you have all those things working together, we're going to be able to change my health now in a real way. And that's why it's important to we're really truly diagnosing our community and then finding the best thing to inoculate and make sure it can get better. And so that's why getting as local as possible is really important. So coalition strategies, as I said, need to address each local condition of the logic model and be really specific to that. So again, if we say parents are drinking at high school football games, all of those strategies need to impact parents drinking at high school football games. We want it to make sure those data points underneath are being directly impacted by the work that we're doing, because this is how we're showing change. We want it to be based on evidence. We're going to talk through those comprehensive strategies. We also want to make sure that we can implement in 6 to 24 months. Again, we want to be able to showcase change. Yes, some things are going to take longer, absolutely, but we need to have some low-hanging fruit as well as those higher goals so that we can build momentum and get people to buy it. And then, of course, it needs to be culturally and politically appropriate for the work you're currently doing in your community. So again, your problem statement, the data underneath that is your long-term objective. Your intermediate, so we want to see change between 1 to 4 years, are our root causes. And then your short term, which is where your strategies are having their first impact, we want to see changes in 6 to 24 months. And this goes back to why it's so important to be thinking about the data and how often we can collect it. And when working with my coalitions, I always say, it's okay if it needs to be, if that's your best data, to have your student survey in your local condition. But we also want to make sure we have a mix of ones we can get more often, because most people are only doing their student survey every other year. And so how can we make sure we're changing that local condition? That's why it's good to be able to have focus groups or some data from the police department or judicial system or somewhere else, environmental scan, that we can do every 6 months or get quarterly, so we can see if we're having any change there. And then I just did want to touch base one more time on strategy selection during this, unprecedented time right now, is going back and thinking, even if right now you have certain things mapped out, thinking, can we do this right now? Is it feasible at this time? Is it a strategy that can be adjusted for the current circumstances? So as you guys were talking about, I think it was Tammy or Mary Catherine earlier, was saying that, we need to change our logic model, because right now that's not happening. Kids aren't drinking in cars. okay, well, the strategies then you have, that isn't going to work either, right? So going back and saying, what can we do for strategies during this current time? Will it impact the local condition and data collected for the local condition during the pandemic? So you're seeing that right now. If you can't do the student surveys right now, what is other places you can get that data, get that understanding? And again, this is where it shouldn't just be you sitting alone with a few people or by yourself with staff coming up with this. This is by having that facilitated discussion with a group of stakeholders help, because you say, great, I'm hearing that kids might be getting alcohol now from home delivery service. How can we prove this? What is the best way for us to go about it? Let's talk to law enforcement. Let's talk to our superintendent of schools. Let's talk to health professionals. Let's talk to retailers. How can we better track this and get support for tracking it? And will the community and stakeholders support during this time? We're all tired. There's a lot going on. We had a long year before this that we're coming out of right now to our new normal. What can we stakeholders really get behind during this time? And asking yourself, you really do need to review your current logic models and map strategies through the lens of what has happened this last year and make those tweaks that make sense right now. Because again, these are living, breathing documents that you should be weaving into the work you're doing every single day. Go back to chat. So comprehensive strategies, that layered approach, as I mentioned, to the work that we're doing. When this is done well, when it really is layered and intentional to impact that local condition, is when we see the most change. You guys have seen this, but I just want to hit it one more time. The 7 comprehensive strategies of provide information, build skills, provide support, change barriers and access, change consequences, alter the physical design, and then policy. And again, that all of them work together to have that impact. So we see here that store windows on Main Street are covered with alcohol ads, isn't the issue. Right there, we're seeing, and I'm going to start from the bottom up. We want a city ordinance that's going to address that. We want to see the signs removed, which is the physical design change. We're going to provide alternative ads to the ones being placed that are pro-social. We're going to recognize the retailers for doing the right thing for taking down the ads. We're going to get law enforcement involved to help us with this. We're going to train people on the sign restrictions, and we're going to send flyers and meet with retailers. Everything works together there to talk about the sign removal. That's what we're really looking at. How can we make sure everything works together to make sure we're impacting that local condition? So for the 7 strategies, again, when we're looking at these first 3, these are really individual. And then the next 4 are when we look at environment. When we're looking, remember the fish in the pond from week 1 all the way back from week 1, we're talking about we need to make sure that we're helping the fish in these first 3. And then the next 4 is how can we change that pond, that overall environment. And so when we say provide information, that's everything from presentations, workshops, brochures, billboards, you name it. The difference between providing information is building skills. Is providing information is us just telling someone something, going out and saying this is the data. When we say build skills, this is where they leave with a new skill. They either now are certified in responsible beverage service, they now are better at DUI checkpoints, a group of school counselors are trained in moral recognition therapy. People are leaving with an actual skill. So it's different than just going and having a town hall meeting where we're discussing something going on. That would be providing information. Building skills is truly about how can we train someone to do something differently. Provide support, assisting others to conduct the trainings, obtain funding for equipment or training, and reach specific audiences. Again, this is one, what can you do to help make the thing happen? Coalitions might not be able to provide programs with a lot of their funding, but they can help figure out how to provide support for them. Do they need to help them get new grants? Can they give them a list of those? Can they bring in new stakeholders to help another agency putting those together? So this is where provide support is really important. Where does a coalition help make other things happen that they might not be able to implement themselves? Change access and barriers. So this is where, how do we make it easier to do the right thing or harder to do the wrong thing? So here are some examples. We're going to provide instructions and training in multiple languages, give scholarships to training programs, or provide training at vendor locations for access. Barriers is enhancing law enforcement efforts for dealing with minors in possession, removing tobacco machines from public venues, and placing pseudoephedrine behind the counter. Anytime we can put an extra barrier in place. Incentives and disincentives, providing awards to businesses who pass compliance checks, public recognition, decrease in liability insurance, whatever it is. What are ways that we can really get people excited and find ways to incentivize them to do something? And then disincentives. What are some things that make it less likely? So increasing citations and fines, increasing excise tax, lose it and use it or lose it laws for driving. All of those ways that we can change consequences or incentives. And sometimes this is a policy change here, as well as number 7. Altering physical design change scores. We're changing something, right? We're gonna put lighting in parks or signage somewhere. When we say signage, we're not meaning a poster, making sure we have like a metal sign that's at the park that says it's a drug-free zone or at our school. Alcohol outlet density, advertising restrictions like we just saw in the sample, product placement and packaging are all ways that we can alter the physical design change. And then finally, modifying laws, policies, procedures, and bylaws. And here I just want to say, remember that we talk about big P and little p a lot. And big P is where a governing body has to vote on something versus little p being something that either a superintendent or a leader can just decide. It's like a practice change. We need both of these. And a lot of times when I first started coalition work, I got stuck in that we need to have this big, massive state law change or an ordinance happen within a local level. And what I really found more impactful later on was those are great and we need them, obviously. There's a lot of things you can do in policy and procedures and practices that have real impact and really quickly. I talk about this all the time with when we were working with social hosting in our community and we thought we needed an ordinance because we weren't seeing any traction. We knew that parties were happening, parents were hosting, but we were never seeing anyone held accountable for it. And it took us putting all 3 mayors in one room for our community, all 3 law enforcement and the DA, the district attorney, to have this conversation to figure out at the end of the day that we didn't need an ordinance. We needed a piece of paper where the police could better put into words what was happening so the DEA could prosecute accordingly. And so it ended up being a paperwork change that made it where we could start enforcing social hosting issues in our community, and we started seeing a change in that. And so this is why it's important to really get down to what's happening and have these conversations, because it could be as simple as a systems change. Also remembering that it could be, when we're talking about policies, like what are some policies of hospitals? What are policies of school systems that we can change or work on? There's lots of different ways that we can change other than it has to be in front of a board of aldermen or state legislature. So really thinking about this as a way of, we don't need to always connect it to something huge to have really huge impact.
So Christina, somebody had asked in the Q&A box, can you give examples? How would a coalition help decrease liability insurance?
So this is, thank you so much for asking that. And that we're tackling that right now in Tennessee in terms of looking at opioids and non-alternatives, alternatives to non-opioids in our communities and throughout the state. And really what it's talking about is, can we bring insurance companies together, whether it's someone who's doing it for with local businesses, how they get theirs. So talking to insurance companies, that would be protecting them versus talking to insurance companies who are protecting healthcare providers, things like that, and having a discussion about how can we provide an incentive for them doing it? Is there a way that we can get a cost? Talking to State Farm and being like, can we have 5% off if they go through this training and change their policies to meet this new standard? We saw this a lot in talking about addressing the recovery community and talking with different insurance providers over if a business is willing to make sure that they have more recovery options and they get trained in this, can you give them some type of price cost differential on that? And so it's really about pulling in new stakeholders. Again, your 12 sectors, that's a baseline. So this is where we need to pull in more people. Having a stakeholder group when you start talking to insurance companies in your area and having this discussion about what could possibly offer is another great way that you could have a policy win for your area. This is another great way to bring in your Chamber of Commerce as well to have this discussion. And it just depends on which insurance you bring in. This depends on who you're working with. So if you're working with local businesses who are paying for insurance, or you want to work with insurance companies to make sure that they will reimburse for a certain type of procedure, like I said, like a non-opioid alternative, like chiropractic care or acupuncture or something like that, then you go and talk to, for instance, Blue Cross Blue Shield of Tennessee and have that discussion. That address what you were asking? Please let me know if you need more insight onto that. So I've already mentioned this, but I just want to hit it one more time that we want to consider all 7 strategies when we're looking at developing our comprehensive strategies. We want to look at both that big P and little p. We want them to be working together to pull over that logic model, to pull over that local condition, the issue of marketing, and then underage drinking. We want to implement strategies over time, but I don't expect you to wake up tomorrow and have all 7 strategies done. It's a slow build to having major impact. And just remember, we're focusing on changing that local condition. A lot of times we can get into the big picture, be like, we want to stop underage drinking. And absolutely we do. This is the way we do that, because just thinking about underage drinking as a whole is really overwhelming. And it's hard for us to have that strategic targeting of knowing how we can make sure we're giving our community the right dose of medicine. By getting to these local conditions and impacting those, we're going to be making sure that we're impacting underage drinking in the long run. So you've seen these before, but I want you to look at them through the lens of strategy versus local condition, because this is really important as you're going back and facilitating this with your community members, because everything you see here is something you're going to hear. So right here, you see that the perception or attitude is youth don't think marijuana is harmful. Absolutely true. A lot of them don't. That could be New York City or Indonesia. That could be true. We want to know, what does it look like for you in your community? What is the behavior because they don't think it's harmful? And also, again, getting back to mapping strategies, if you don't think marijuana is harmful, we just go right to, well, we just need education because we haven't unpacked it enough to have real impact. But here, when we say you don't think marijuana is harmful, so what is the behavior? Well, the behavior is you vape marijuana and other substances in the parking lot at lunch. Now, all of a sudden, I have the right dose of medicine to change that. We can still provide the education, absolutely, on the dangers of marijuana, but we're also going to enhance monitoring at the parking lot school lunch. We're going to update procedures and train school staff to address students who are higher drunk in class, and we're going to update the school policy to include vaping and e-cigarettes. All of a sudden, we went from we're just going to have an education campaign to probably not impacting our use to having this really specific local condition that we can have these set of strategies that really will change perception later on once we can change this, because they're going to think it's more harmful because they're going to get in trouble for using it. Another example. Again, alcohol is a rite of passage anywhere in the US, anywhere in Europe. Alcohol is a rite of passage. And it just gets us to one strategy, that we're going to do a public awareness campaign for health risks. But when we unpack that and say, what does rite of passage mean in my community? What does it look like? Because it's a rite of passage, what are people doing? And here it's that, you know what? It's a rite of passage, the 4th of July bash that parents and youth will picnic and have alcohol together in celebration. And so now we went from, we can do that public awareness campaign, but we can also enforce open container laws and minor possession laws in our community celebrations. And we can update city permitting process to control alcohol in public areas. So all of a sudden we went from being able to not really give the right dose of medicine to being a really specific dose to change that local condition. So we hear a lot of this, the lack of a resource, and we have it everywhere. And we say, because I just keep coming back to, because there's a lack of a resource, what is happening? Because we have no education on RX drug use, what is happening? Because when we just say that, our answer is, we'll just have some education in our middle and high schools on prescription drug misuse. We actually go back and unpack that and say, what's happening? What does this look like? Because we have no education on prescription drugs, what does this look like? Well, high school athletes share their prescribed painkillers with their fellow athletes. Then all of a sudden we have all these opportunities for strategies to really impact that. To make sure we have a prescribed program that works directly with athletes, right? So we know we'll have more impact with any program we put in place, but we can also train coaches and nurses to monitor athletes. We can work with prescribers to regulate prescriptions and educate parents, and we can update school policies and procedures to ensure monitoring of athletes' prescription drug use. We suddenly go from just being like, okay, now we have a program, to this like list of prescriptions that are really going to have an impact on this. And again, we know all programs don't work for all students. All programs don't work for all adults, but now we're able to say, okay, we know that this one will work for athletes. And on top of it, we're going to back it with these policies. And then we're going to be able to change their behavior around this, which is what we want, which will then change that thought bubble of them thinking, perceiving that it's okay. It really allows us to be more comprehensive. Tina says, I always look at local condition as something I could visually see, take a photo of. Hopefully that's the right way. Yes, absolutely. You can take a picture of no education, but you can visualize high school athletes taking prescribed, sharing their painkillers with fellow athletes. We can see that. You can make a comic strip about it. You could tell a story about that. There's no story behind no education program. I can see this. You could tell me about how it's affecting athletes. We have a story, we have a name, we have a face to it. So that's a great way of looking at it here. And so thinking about going back to, we saw this earlier. Now thinking about the data we have mapped here, what are some of the things we could do to impact resellers selling alcohol to minors? So these are some examples of that. So if we want to impact our local conditions, retail stores are selling alcohol to minors. And I'm going to start at the bottom. For me, if you're doing this, sometimes maybe your mind works where you start with number 1, provide information. But I find real clarity in starting with number 7, being like, what is the policy or regulation or practice that I want to see change, and then back up everything else to match it. So I'll kind of show you how my thought process works on that. So we're going to increase compliance checks and fines, right? So as part of that, we're going to help them by providing signs to say we don't sell to minors. And then their consequence is going to be they're going to get increased fines for those failed checks. And we're going to recognize sellers who are passing. To help with access, we're going to translate that merchant education into Spanish. We're going to support them by giving assistance to store owners and posting signs and training clerks. So we're going to train them as a coalition, and we're going to go out and have coalition members help them with posting the signs. In terms of building skills, we're going to train merchants to check IDs and look for fake IDs, and we're going to provide them information on current laws. So everything is based on the fact that we want to make sure that we're increasing those compliance checks, and we're going to give them all the support they need to make sure they pass them. But if they fail them, they're going to have an increased fine. Sean says, we are having a difficult time coming up with local conditions. We are a new coalition and have quantitative data, which is big. We need to do focus groups. We have some youth. We have youth reporting obtaining alcohol from someone they know, for example. We have no local conditions on specifics. Advice. So Sean, my advice to you would be to truly grab a group of people and to start having this discussion. Grab a few key youth in your community. Grab some of the school counselors possibly, or someone in treatment in your area, or providing treatment recovery services, and maybe some law enforcement, and have a conversation like, listen, we know alcohol is an issue and we know availability is an issue. Where are you getting it? And what data do you have to prove it? Even I would, like I said, I would pull together someone from law enforcement, someone either from the school, either school counselor or some type of superintendent or administrative that would have access to data for you. And then definitely someone from treatment and recovery and some youth, and have this conversation. Even possibly do the community mapping exercise where you're talking about, tell me about what alcohol use looks like. Where is it happening? When is it happening? And really kind of facilitating that conversation. That will help them help you get that data, and might provide you with more of those stories where you guys can back it up by asking more specific questions. Because it doesn't just have to be a focus group or on your survey. It could truly be having this discussion, and having law enforcement might right there be able to tell you that for their minors in possession, that they're able to say they're getting it from here or there. Another great is youth probation. We had youth probation on our board, and they have always been great about saying, okay, the youth we're having, majority of them are coming in with alcohol issues, and a number 1 place they say they're getting it when we talk to them is from parents. So those key informants are key. But I definitely would, like I said, put together 5 or 6 key people and just ask this question. We know alcohol is an issue. We know availability is an issue. Where are the kids getting it? And then as they're talking about, be like, how can we find data to prove this? How can we back this up? It would be my advice to you. And that's, like I said, this is a problem whether you're new or old, especially with emerging trends. I think we saw meth, we see opioids coming up, or when the kids are using prescription stimulants, is having a conversation where we pull people together again and start breaking it down. Sue says superheroes take on villains by rescuing one situation at a time. Absolutely. We can't cure everything overnight. We can't say we're going to take down all of underage drinking. What we can do is compartmentalize it in a way where we can slowly break it down so we can have real impact.
Hey, Christina.
Yes.
So Tammy had asked, can you speak to measuring comprehensive strategies and tricks to make it happen or ways to make it easy? They're the only staff person and they can't be everywhere at once.
Oh, absolutely not. So when I'm thinking of measuring comprehensive strategies, really, I'm thinking about process measures maybe. When it comes to measuring, the only thing we really want to measure is those two ones underneath that local condition, those two data points. So making sure that those data points are something you can readily and easily get. So it'd be great if one of them is archival, something you can just know that you're going to email the police and they're going to give to you, or that the police, you work on your coalition involvement agreement or memorandum of understanding to realize that they're going to automatically send it to you every quarter. We used to do that with our police and with our judicial system. Anything that would make sense for them to highlight or have to us, or maybe even bring it to your coalition member meeting every quarter. And then making the other one something that you would get maybe every year. So having a focus group every year or a listening session. And again, making sure you're training other people and helping you get that. When it comes to process measures, the idea of saying, okay, have we done enough signs or how many of this? We really built it into forms that the coalition members would take. So if we were having them do an environmental scan and saying we need to have so many posters up, I would make sure that, listen, there are people who wanted, this is the story I'm going to tell you. School counselors, great example. Overworked, underpaid, but brilliant at helping us in everything we did with coalition work. Sometimes they would come to coalition meetings and they were burnt out and stressed. And their best thing that sometimes they could do is help us was to count out specifically what was going out to people. The bags that other people were taking out when we were visiting pharmacies and hospitals and medical professionals with campaign materials, they would literally map out what was in every single bag. And then people would write down how many bags they were taking on the sign out sheet and to who, and then they would report back that it happened. So we really built in the process measures, not me counting out 5 signs or me counting out, to really having forms that they filled out. So whether it's on SurveyMonkey or it's on a sign out sheet when they're grabbing the materials, that's what we did. And we really had that group of school counselors who they were tired, but they wanted to help. And that was a quick way they could help us, whether it was for campaign materials or handing out pamphlets or whatever it was. One of the other things we did that really helped with process measure was at the end of every agenda we had where we could quickly place. So our board chair would count up how many people were there, what were the main things they talked about. So it's a way of trying to make sure you're implementing it into the work they're doing so they can track it for you with sheets, is the way that I found it most effective. So it wasn't me sitting there counting something out, making sure it happened. Like if they went to a meeting, they were reporting back on it. So it's doing the work now on some of those reporting mechanisms that are going to make it not land on your shoulders, I think is the easiest way to go about it. So some of the key points I just want to bring us back to is this is a process, everyone. Like I said, they are documents that should change and evolve as our community change and evolve. Don't get locked into it. Know that this is about what your community needs in diagnosing it and providing the right support. Continue to think layered and coordinated. Everything should go together for a reason. Again, if you look at your logic, if you're doing something and it isn't something that directly impacts your local condition or capacity, why are you doing it? So go back and say, do we need to change the logic model or do we need to change what we're doing? And if you are doing something that is not directly related to your logic model, change it, as I said. And I always say this about the strategic prevention framework. It works if you work it. It is something that is a process and should be woven into what you do. Your assessment shouldn't just be sitting in a folder, your logic model and evaluation plan. It should be stuff that's right in front of you that your coalition knows about so you guys can continue this work together. And it really does start with that storytelling piece. If you take one thing out of this, go back, put some key stakeholders together and be like, tell me the story. Let's work through this together. Let's facilitate this problem analysis into a logic model. And then I think, oh, yes, of course, there's always more support from CADCA. So make sure that you are getting onto the CADCA's Online Essentials course. or creating separate work groups that can be organized around drug, root cause, local ignition, or strategies. I know some of you said that you had short-term action teams. I absolutely love that. That's what we use. So however you can break down the work to make sure everyone's getting what they need and can be involved in whatever way possible is important. And then of course, make sure you always access coalition development support. 1-800-54-CADCA extension 240, or if you're involved with the National Coalition Academy, your instructors for coalition development support. But anything that has to do with webinars, make sure that you 1-800-54-CADCA extension 221. And I thank you so much for being with me today. I hope I was able to answer most of your questions, and I'll make sure I get those resources to Brittany so she can get them out to you.
Thank you so much, Christina. So I am putting, oh, that's not the right link. Don't send that one to them, Brittany. I am putting in the chat box now our evaluation link, so you can go ahead and fill that out. And Christina, there was one other question that I saw somebody had asked earlier about, is there's a webinar on conducting a problem analysis meeting. How do we keep it from becoming a he said, she said complaint fest? You're muted.
Thank you. That's a great question. So the he said, she said, the best way to do this, and actually we're working with a Hawaiian cohort right now that brought this up, and this is how they do it. Write it all down, get it on the piece of paper, whatever anyone says, how they did it, and then have them talk through it and work through voting on which ones make the most sense from them. So yes, you don't want to turn this into a grousing session of he said, she said, but making sure that you're facilitating and writing everything down that people say, and then going back and saying, okay, which ones are we backing up the most? Which ones are we hearing the most often, and group them together? But yeah, and then also I always say, you know, your key members that might struggle with this a little more, making sure you're pairing people up that make sense. And if you have two people that are very similar, making sure they're in separate groups is really important too.
I think the other thing is, again, like as Christina was saying, reach out to coalition development support. If you have specific questions, and I think to everyone, right, your coalition development support coach is there to answer questions and can work through, anyone from coalition development can kind of do like an hour call where you can work through really specific problems with them that you're facing and you're coming up with. So don't forget that that's a resource, not just as you're going through the academy, but after you graduate, as you're going through, you know, years down the line in your coalition work. So, well, I don't see any other questions in the Q&A box, and we are at 2:32. So Christina, thank you so very much for this great training today. And as I said, recordings and resources will be up on the website in the next couple of days. So please make sure to take a look there so that you have those. You can come back, you can share it with some of your coalition members, and don't forget to complete the evaluation. And we will see you all during your week 3s in the next couple of months, or the next couple of weeks. They start in July. So thank you, everyone, and have a great day.